Are you struggling with chronic pain and inflammation due to degenerative disc disease? Degenerative disc disease can significantly impact your mobility and your quality of life, making even simple daily tasks a challenge. Finding effective supplements that rebuild discs, alleviate pain, and reduce inflammation is essential for restoring your disc health and improving your overall well-being. In this video, I'll reveal the top 4 supplements that can help you manage degenerative disc disease symptoms and enhance your spinal health. I understand it'd be confusing to figure out which supplements are really effective and safe. You might be worried about the potential side effects of supplements and how they might interact with other medications or conditions. Don't worry, I've got you covered. I'm going to give you clear, easy to understand, research-based guidance to help you make informed decisions and safely incorporate these supplements into your health routine. And contrary to popular belief, you'll also learn how discs can be enlarged through vitamins and supplementation. That's right. And I'll share case studies to back this up. On their own, these supplements help repair degenerative disc, but when combined with revolutionary non-surgical robotic laser spinal decompression, the healing process is accelerated, leading to extraordinary results. More about that later in this video. Hi, I'm Dr. John Zlonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. I'm the founder of National Health Day in Canada, and I'm very honored to say we've been voted Ottawa's best 16 times. As well, I've had the privilege to work with some of the world's best athletes. Why should you listen to me? I wrote the book, Science of Vitamins Meets Optimum Health and Common Sense, not just the first edition in 2012, but also the second edition in 2020 as well. It's available on Amazon should you like it. It's important to watch right to the end because I'm going to be dropping a number of what I call health nuggets that many don't know and can make a major impact in your life. One of those is the science behind all these vitamins. I'm sure you run into some people who still believe that there's not a lot of science to vitamins. They couldn't be more wrong. In the first edition, there are 100 pages of scientific references in here. It's something where it's very ground. You may also run into some people who don't believe in vitamins. Again, read the book. I'll take you through a very simple step-by-step flow chart. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. Now, before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs or surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it all in the link in the pinned comment below. Now, in a moment, I'm going to outline these 4 supplements for restoring disc health, but first I need to highlight this important concept. Degenerative disc disease is not inevitable. That's what you've been taught. You've been taught, hey, as we get older, we're supposed to wear and tear, and it's inevitable, and there's nothing you can do about it. That's simply not true. What do I mean that degenerative disc disease is not inevitable? Well, understand the way these discs degenerate is really through 3 main processes. Number 1, if I damage something, it's going to wear and tear faster. Number 2, if I lose movement specific to that individual vertebrae, it's also going to wear and tear faster. And the reason for that is the movement that pumps nutrients into the disc. And then number 3, here's another health nugget we're talking about that no one's telling you about. The body's capable of producing the nutrients that actually build that disc. It stops doing that about age 40 or so. So here's the thing, is those 3 things are happening. If we counteract those 3 things, we can actually slow degenerative disc disease. In a lot of cases, we can stop it. And especially in my health center, we've even been able to reverse it. Now, later in the video, I'll tell you where you can access some of the best vitamins on the market. But first, here are the top supplements that I recommend for disc degeneration and restoring disc health. So the first supplement that I recommend for degenerative disc disease is probably not what you're thinking. One of the mistakes, this is another one of the health nuggets I'm talking about, one of the mistakes people make is they think that health is one thing at a time. So let me give you an example. They've heard, oh, I've heard vitamin C is good for cold. And yes, is vitamin C good for colds? Yes, but vitamin C works with so many other things hand in hand. It's the same thing with degenerative disc disease. I'm not going to tell you, oh, you just need glucosamine, or you just need MSM, or you just need chondroitin, and so forth. These things work hand in hand, because remember, what we're trying to do is we've taken, in degenerative disc disease, we've taken this nice thick disc, which allows for lots of room for this nerve to come out, and we have thinned it out. We have actually, there's the wear and tear, whether I call it degenerative disc disease, degenerative joint disease, osteoarthritis, spinal decay, they all mean the same thing. And when that wears out too much, the body will then actually react by growing bone, is what we call spurs or osteophyte, in an attempt to actually fuse this together. That's what we don't want, because once it's actually fused together, the body does this so that you can't turn anymore and not put pressure on the nerve. But these are the people who you see who, when you talk to them, they move like this because there's no movement anymore. That's not what we want. It's how they used to do surgery decades ago. Unfortunately, they still do it today, and they now knew decades ago that it was a terrible way to do the surgery. We do not want things to be fused. So what we're trying to do is we're not looking for one thing, we're looking for a comprehensive approach. So supplement number one is what I call Acute One. This is produced by Core Science, one of the best supplement companies on the face of the planet. We'll get to that in a second as well. So what we're looking for here is what Acute One is. It's a comprehensive blend of specialized protein-degrading enzymes, what we call polyphenols. So those, just think of those as plant chemicals, and botanical extracts that are formulated to promote a healthy inflammatory response. Because understand, the word osteoarthritis, or degenerative disc disease, but osteoarthritis, anytime you add itis anything, that means inflammation. We need to bring the inflammation down. So what we don't want is we don't want a lifetime of the Celebrex and the Naprosins and the Voltarens and the Advils, and so forth. They have nasty side effects. They will eat away at your stomach. There are people who die every year from taking these. We want a natural but comprehensive approach. So in this, what we want is when we actually take this on an empty stomach, especially these proteolytic enzymes, which are basically just enzymes that break down protein that have come from damaged tissue. So we want to deal with the damaged tissue that's happened with the osteoarthritis. Also includes things like curcumin and ginger and boswellia. They've been used centuries in Chinese and Ayurvedic medicine, and all these things will help to modulate the production of inflammatory compounds. We even add quercetin, rutin, resveratrol. Again, it's a combination of phytonutrients, and they're all going to help protect the cells from excess oxidative, what we call oxidative stress. So what we want is, number one, we want a natural anti-inflammatory that's going to bring down the inflammation in the body when you're suffering from degenerative disc disease. The second supplement that I recommend for people suffering with degenerative disc disease is also from Core Science. It's called OA Max. OA obviously just stands for osteoarthritis. It provides joints with nutritional support for lubrication, for free movement, and for healthy function. So think of this as we want the nutrients that are actually going to start to rebuild this disc and this cartilage. So joints, cartilage, tendons, synovial fluid undergo this continuous but slow turnover and what we call a remodeling process. So this is always happening. Are we giving our body the nutrients that it needs? And again, as I said earlier in this video, at about age 40, the body stops producing that. Then also understand this is affected by many physiological factors. How's the rest of your diet? What other supplements are you taking? What's your activity level like? How's the stress? How's your gut health? Where's your immune status? How old are you? Aging will play a certain role, although there are things you can do to counteract that. What's happening with your hormonal levels, with what we call your toxic load, or with your various medications that you're taking? All these things will affect your body's ability to actually regrow this disc in here. Now, the typical components that people are used to hearing, things like glucosamine will be in here, MSM will be in here, hyaluronic acid, which is a lubricant, in cartilage. It's interesting, watch any TV commercial and people love the fact that you've got your hyaluronic acid in for your skin. Well, why are we not using it to actually rebuild the cartilage going on in degenerative disc disease as well? And then to that, we're going to add things like boswellia, turmeric, again, some resveratrol. That's all going to help to promote that healthy inflammatory response. And then last but not least, again, as you're seeing, it's not one thing. You can't just use one thing. We'll have, again, in the OA Max, you're going to have targeted amounts of niacin, zinc, selenium, copper, manganese, again, all the minerals that your body actually needs, especially in what we call their bioactive forms, to support joint function and joint health. The third supplement that I strongly recommend for degenerative disc disease is you need to have a good essential fatty acid compound. This particular one comes from Designs for Health, Core Science has a great one, Douglas Labs has a good one, Metagenic. You want to go to health professionals, to the quality lab. Please be careful, because a lot of the essential fatty acids are sold, can easily become rancid, don't have the same purity, the same quality. So what an essential fatty acid is think of this as your good fat. You're probably best known, most people understand this as omega-3s and 6s and 9s. Specifically, we want to get into something called DHA and EPA. And what we want is, what this does is it actually modulates your body's ability to produce hormones. It's what we call prostaglandin. And so think about it, the body's capable, comes out of a chapter out of one of my books, Nutrition Insanity, what we call, it's going to sound like really silly examples, what we call apple juice and stewed mosquitoes. Think of your body as great way to remember this. Think of your body as this machine, and what if it was only capable of either making apple juice or stewing mosquitoes? Well, obviously, the more apples we put into it, the more apple juice we're going to get out. All we did was actually eat mosquitoes, well, all it could do is stew mosquitoes. So same thing applies to you producing the hormones that either create pain or actually, create a better feeling of wellness. And that's one of the many things that essential fatty acids can do. Also good for brain health and heart health and also inflammation and so forth as well. But again, what we want is make sure you're getting it from a quality supplier. And the fourth supplement that I strongly recommend for people suffering with degenerative disc disease, also from Core Science, is something called Nerve Regen Max. Again, understand that if we are suffering with osteoarthritis or degenerative disc disease, we have thinned out these discs. The more we do that, the more likely there's going to be pressure on those nerves. So what happens in degenerative disc disease is you may find that you're constantly having pressure on these nerves. That may develop into what you think is the sciatica or the numbness or tingling or pins and needles coming down the leg. Understand those nerves control everything. So those are in that area. So those are the same nerves that go to the bowel and the bladder and the reproductive organs. You may notice symptoms there. Understand those nerves are what actually control the muscles. So you may get to a point where there's actually weakness comes in there as well. What Nerve Regen Max is geared to do is it is specific to start to regenerate the actual nerve tissue and to actually not only that, but create the energy necessary to also help with that nerve tissue. So this is going to be everything from benzphosphoamines to pyridoxaliphosphates to methylcobalamins, possibly some terms you haven't heard before, but again, all based on the science specific to create the energy going to help you regenerate the nerves. And obviously in degenerative disc disease, those nerves have been affected over the years that it's taken to actually develop the degenerative disc disease in the first place. Now, although these are top recommended vitamins and supplements for degenerative disc disease and for restoring disc health, always check with your health professional before taking any new vitamin or supplement. One of the key things I mentioned earlier that I would warn you about, for instance, something like glucosamine, people are buying off the shelves left, right, and center and so forth, is understanding glucosamine is not recommended for people who are on blood thinners, for example. Now, the reason for that, again, people get scared of this and then the whole idea is, well, I don't want to risk anything, and we're not suggesting you take any risks. What we're suggesting is understanding what's happening. So when a vitamin or a supplement and some drug actually meet inside your body, they typically do not create some explosion or a terrible reaction. What happens in the majority of these cases is the drug you're taking and the supplement you're taking may cause the exact same effect. So for instance, in the case of someone who's on blood thinners, you may be on your Coumadin or warfarin or something like that, and then if you take too much glucosamine at the same time, which also has the ability to actually thin out the blood, what's going to happen is you're going to thin out the blood too much. Now, is that a concern? Absolutely, yes, it's a concern. What we need to do in a case like that is that's when, again, you need to talk with your health professional. Do you reduce the blood thinner? Do you not take the glucosamine? Are there ways to monitor that? Those are the things that you want to look at. Something, for instance, in the acute one, we do not recommend you take that when you're pregnant. And so again, things, please talk to your health professional who has an understanding of this. Now, it's important to understand where to get these supplements. Unfortunately, there's a lot of stuff being sold to you that just is not of really good quality. So here's another health nugget for you. There's only one scientist who truly independently rates all the vitamins and supplements every year. He started doing this some 10, 20 years ago. When he first did this, he looked at 1,500 different products and rated them on a 5-star system. And do you want to guess how many out of 1,500 got a 5-star rating? 4. Today, it's a little bit better, but still less than 1% get a 5-star rating. And unfortunately, most of the stuff that you are self-prescribing, most of the stuff that you're picking up in the box stores and the drug stores and so forth, even some of the most popular known brands, you want to guess what they scored out of 5 stars? Either 1 or even half a star out of 5. So please go to a health professional who understands this well and someone who you trust. Okay? And that's where you want to be getting your supplements for. Now, last but not least, in addition to combining these supplements, in our health center, what we do is, as you know, we also utilize something called non-surgical robotic laser spinal decompression to help with this disc healing. And essentially what it does, if you've seen some of the other videos, is we talked before about how you need these supplements. Well, guess what? Non-surgical robotic laser spinal decompression literally causes that decompressive effect that separates those degenerating discs, and that pulls those nutrients back into the disc. It rehydrates disc. It takes pressure off the nerve. It's amazing the results that we we can see. And yes, we have multiple case studies where a number of our patients have actually increased their disc height on x-ray. Now, you don't go from 1 millimeter to 20 millimeters. We have lots of patients who are 1 or 2 or 3 millimeters only left of disc space who are now 2, 3, 4, 5 millimeters of disc space. And the more we can actually regrow that back with the proper approach, the more movement, the better lubrication of the joint, the healthier the disc is going to be, the less pressure on the nerve, whether it's from stenosis or degenerative disc disease or sciatica. All these things, we want to take the pressure off the nerve, and then we want to supplement with the appropriate natural supplements that are based in the science to actually help regrow that disc back in there. Now, I know that was a lot of information for you today, some really great health nuggets. Please take action on them. You now know the top 4 supplements. So we need to bring down the inflammation naturally in degenerative disc disease. We need to actually give you the nutrients that can help to regrow the disc in there. We can actually do things to actually help to regenerate the nerve and even bring energy, and we can even control the pain symptoms that occur through hormonal modification in there as well. All these things can help you manage your degenerative disc disease symptoms and enhance your spinal health. Now, also share with you where you should be getting your best vitamins from, and I also introduce you to non-surgical robotic laser spinal decompression. Now I want to hear from you. What supplements are you taking for degenerative disc disease? Out of the ones I mentioned, which ones are new to you? Please leave a comment and let me know. If you found value in today's video, please like it, please share it. Be sure to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. The next video you should watch is this one here if you want to learn more about non-surgical robotic laser spinal decompression and how we use it to treat degenerative disc disease, disc herniation, spinal stenosis. Please go watch this video now.